I'm excited to let you know about a new investigational device that we're looking at. And this new device is for the low back pain, leg pain primarily, with degenerative disc disease. This is for one level of a bad disc in the back, with or without arthritic facet joints, which are the joints in the back of the spine, that may be causing pinched nerves or leg pain, and possibly if you also have back pain. And this is a new total joint replacement developed by a company called 3Spine. And I'm one of the 20 centers in the United States that's performing this new trial on the new device. What's unique about this, for those of you that are familiar with artificial discs, this is a little different. Artificial discs go in through your stomach. This device goes in through your back. So we don't have to go through your abdomen. And we remove the facet joints and implant a motion sparing device to keep normal physiologic motion of the spine, yet removing arthritic joints and relieving the leg pain and back pain. So it functions like an artificial disc. It's called a total joint replacement. The term for it is MOTUS, M-O-T-U-S, which is Latin for motion. And this study is designed for one level of the low back. It's an investigational device exemption trial. So you're exempt and able to have this implanted if you qualify for the study. So you would make an appointment with me and see if you qualify. And if you do, we could enroll you in the study and implant this new device. So right now I'm going to show you the model of this device. This is the device itself. The clear acrylic would be the spine bone, the vertebrae, and that's the actual device. And you can see it moves, so you're able to roll and move on that device. It goes in through the back. When we remove the arthritic facet joints, the nerves are released, and this relieves the leg pain. And the implant itself elevates the collapsed disc or degenerative disc. If you have back pain, it'll help that. But still allows you to maintain motion and mobility of the spine without fusion. And you know how passionate I am about motion and preserving mobility of our spines. If you think you may be a candidate, come in to the office, make an appointment, see me, and we'll determine. And hopefully you're a candidate and you'll qualify for the trial.